2 weeks ago, I got a call from my mom's oncologist letting me know that I had tested positive for a BRCA gene mutation, and today I'm heading in to meet with him to find out what that means.
This particular gene is called BRCA1. It's the same gene that your mom has. When you think about risk of inheriting this from your mom and risk of your kids inheriting it from you, it's about a 50% chance. And you can see that in that your sister does not have this gene and that you do have this gene. What this gene tells us is that there is an increase in risk of both breast cancer and ovarian cancer. And that risk is estimated between high 50s to high 80s lifetime risk of breast cancer, which is pretty high. And then about a 40% lifetime risk of ovarian cancer.
It is now Monday morning. I am heading in to have a mammogram done. Erin made me a wonderful breakfast, so I'm kind of leaving in a hurry with my food and some coffee. My office visit was really smooth on Friday. I got a lot of information. The doctor did one of those like self-exams where he feels for anything. He didn't find anything. It was really smooth. So the next thing for me is to have this mammogram done. I'm gonna go do that now, and I expect to have the results back in 2 days. I'm heading out today to meet with a local general surgeon who specializes in patients with breast cancer. I'm hoping that they're going to have an ultrasound at their office, kind of like you would have when you're pregnant going to your OBGYN, because my mammogram really wasn't an effective tool for detecting early signs of breast cancer since I have dense breast tissue. I didn't find that out right away, and so I was waiting for the results from the mammogram, and I only found out via letter that I would need to get an ultrasound done. I'm really glad that I had already scheduled this appointment with a local breast surgeon. I'm here. Hopefully I'll be able to have an ultrasound done today. We'll see.
So we saw the plastic surgeon today. They are going to come in and do their work after the breast surgeon comes in and removes the tissue. The way it was described is that they intended on doing the incision first, letting the breast surgeon come in and remove the tissue that they were going to remove, and then after that he would come back in, put in expanders, and what he said is if the skin is in good condition or strong, he would leave it over the muscle, but if it wasn't as strong, that he would put it underneath the muscle, and he would make that decision while he was doing the surgery.
Erin and I are going in for pre-op appointments today, so we'll be seeing the breast surgeon, the plastic surgeon, and then also we're heading by the hospital. Wow.
You can capture our faces.
Okay. Cool, guys. So this is a tissue expander.
Right, so this is a tissue expander, so what's going to happen is bring the magnet over here, so you put this, let's pretend like this is your breast flap, you put this underneath the breast tissue like this.
Yes.
And then you use a magnet, and then the magnet, look, it's like a little tracker.
Yeah.
It will point to where this is,
Yes.
which is the metal part of it, and that's where we will put the needle in through the skin to expand it, make it, and this will just fill up with saline as time goes on. And this is the final implant, so once that gets filled out, then we go swap it out for this.
Let's get the bigger one.
A lot of surgeries coming up.
Yeah. So tomorrow is the big day. I'll be heading into the hospital at 8:50 in the morning for my prophylactic double mastectomy, and it should be a 3-hour procedure. I'm hoping to basically be in a room by dinner time.
So the other thing to discuss is the ovarian cancer risk reduction. So you can have ovaries removed and still take hormones to replace them, and that cuts down ovarian cancer risk reduction.
I'm very interested in that.
Okay, and you are totally a candidate for that.
We also now found out when we're going to do the vaginal ultrasound.
have my visit with the doctor who will be performing my hysterectomy next week. After I meet with the doctor at his office, then I will head over to the hospital and do pre-op there. That visit went extremely well. I basically signed paperwork and then I discussed with the doctor what to expect. It sounds like it's going to be pretty simple. They will be going in laparoscopically, so I'll have a little incision around my belly button and then one on either side. Here's what those wipes look like inside of the package. They are super thick. And so I'll just be rubbing this on my abdomen. My sister is here. The procedure starts at 10 and Erin is staying home to watch the kids and work today. This should not be a big ordeal and I plan to be home, basically in like 36 hours. So here we are, I made it. I'll be changing into the gown and cleaning once again with this awesome thick wipe and antibacterial stuff. This will be my hat and my socks, yay! This is the warming blanket and it is the coolest thing. I absolutely love this. My favorite nurse, the nurses here are great, but my favorite nurse was in the recovery room today and she was able to wheel me to my room and Sarah got to meet her. So the pain from this procedure is nothing like the pain from the double mastectomy with the reconstruction. Ooh.
So we have these on her legs. It helps keep circulation going so that there aren't any blood clots while she is stationary in bed for long periods of time.
It's kind of nice, like someone's rubbing your leg.
We had a little bit of a hiccup. She has what is called a hematoma, and that is basically a pocket of blood that has pooled up inside of her stomach.
So we just found out that my hemoglobin numbers are continuing to go down, and that is because I am bleeding internally. I'm going to get a blood transfusion. It's my first time ever having one of these, so yay!
I've had it done before.
Yeah, Sarah's awesome. Yeah, so we're just having sister bonding, and it looks like in the morning I'm going to be going back into surgery. I have had like significant swelling and it's like bruising and it does not look good, but they're gonna try to go in and figure out why I'm having this problem and they'll fix it. So that's the deal. I just got back from the second operation and things are looking really good. My surgeon explained to Sarah what was going on, so she has some good information, but I'm feeling good. I should be going home tomorrow. It is the morning of day 4 in the hospital. It is 10 after 6 and I'm really eager to go home. I was not planning on being here for 4 days, and I totally can't believe that literally 24 hours ago I was in surgery trying to get that blood clot and the extra blood out of my abdomen. I have crazy, ridiculous bruising, but that should go away in like 4 weeks. The doctor just came in and shared with us the news, eyeball to eyeball, that my pathology report came back. Everything was benign and there is no sign of cancer, so now I have zero threat of any kind of ovarian cancer and basically no threat of breast cancer. So those two, which were really the only significant problems, those were the high percentage rates, I am clear and we're just so thankful. So I am really good. I'm on the road to healing, and for anyone out there, if you have this BRCA gene mutation, it was a really good experience for us having the testing done and finding out that we're okay and that there are things you can do to take care of yourself. If you have insurance and access to those things, I would recommend them from personal experience, and it's not something you have to be afraid of. You can just deal with the fear and get those procedures done And you could also find yourself in a place where you realize that you're healthy and able to live a full life, and it doesn't have to be something that you carry with you. It's awesome. Just praise the Lord. Has Ezra been winning?
He hasn't won one game. Isaac, you mostly just belly flop me. I just keep getting.
Belly flop.
I only won. Isaac, you jump on one thing one time.
High five. You are so awesome. You are so awesome. I want to introduce you to my nurse for today. She will want to meet you guys.